Hi, this is Dr. David Keynes. I'm one of the urologists at Leahy Hospital and Medical Center, and today I'm going to talk to you about robotic radical prostatectomy, what to expect after surgery. We're going to address concerns after robotic surgery, and we're going to go through each of the main issues that we think are important for you to be aware of before you have surgery. So let's first talk about postoperative pain. It's probably forefront on your mind. And there are three main focuses of postoperative pain. The first is pain in your incisions. You'll have 5 or 6 little cuts on the belly. And the pain is usually mild to moderate. But most patients can control their pain without using opioids. Rarely you'll be given a few pills to take just in case, depending on your surgeon, but the vast majority of patients these days undergoing robotic radical prostatectomy can manage without opioid pills, and we'll get to the details in a second. So you may have some mild pain by your incisions. The catheter may cause some discomfort. The catheter is obviously a foreign body in the bladder, and the bladder reacts by making you feel like you have to pee. So you may feel, when you wake up from anesthesia, strong sense of urgency, like you have to pee, even though you don't. That's a feeling of discomfort from the catheter itself. Another common complaint is shoulder pain. Now, if you wake up with shoulder pain, there's nothing actually going on with your shoulder. Your diaphragm got stretched during the surgery from filling up your belly with gas. The gas has been evacuated, but the diaphragm stretched, and that hurts. But we experience diaphragm pain in our shoulders, either one or both sides. The only thing I can tell you about that is it will go away with time, and sometimes it can be severe. We're going to talk about how we recommend controlling the different types of pain. Your best bet is to use TYLENOL and IBUPROFEN alternating. If you take each one of these every 8 hours, you'll have some pain pill available to you every 4 hours. So let's say we start at noon. You take TYLENOL 1,000 milligrams. That's 2 500 milligram pills. And then at 4 p.m., 4 hours later, you've got 600 milligrams of ibuprofen available to you. That's 3 pills of 200 milligrams each. So at 12 you took the TYLENOL, at 4 you take the ibuprofen, at 8 p.m. you'll have the TYLENOL available to you again. And in that way of alternating, every 4 hours you'll have something available. Would not go over 3,000 milligrams of TYLENOL in a 24-hour period. Now let's talk about diet. You're going to start off with mostly clear liquids, things like Jello, soup, water, and as you feel able, you can introduce solid foods. I recommend you start with smaller portions, maybe half portions first, and then slowly get back to your normal portions. If you feel like you're burping too much, you're feeling bloated, nauseous, you need to back down on the solids and stick mostly to liquids. You do not have to wait until you pass gas or have a bowel movement, but those are sure signs that your intestines are waking up after surgery. Let's talk about catheter care. You're going to wake up with a rubber catheter in the penis that goes into the bladder. That's called a Foley catheter. And that catheter drains the bladder urine into a bag continuously. You'll be given 2 size bags. One of them is smaller, and that's also referred to as a leg bag. And another is larger. That's sometimes referred to as the night bag. My recommendation to you is that you mostly keep the larger night bag attached to the catheter. In fact, you don't ever really have to switch it to the leg bag unless you are going out and you want something discreet that can't be seen under your clothing. You can even go out of the house with the large bag. Some people will put that large drainage bag in, say, a shopping bag or a canvas tote so that the urine itself is not visible. But it may simplify things to keep things attached, to keep the catheter attached to the large bag for as much time as possible. It tends to drain a little bit better and be easier to manage. What about if urine leaks out around the catheter? That's fine. That can happen. It can be normal. The one thing you need to check is that the bag is still filling up, that there is still urine draining through the tubing and filling up the bag. You should call us if there's leakage around the catheter and the catheter itself doesn't seem to be draining. In that case, the leakage might be because the catheter itself is clogged, and we would want to know about that so we can help you through it. What about bladder spasms? Bladder spasms is when your bladder tries to actually squeeze the catheter out of the body. Now, the catheter is held in because it has a balloon on the end that's larger than the diameter of the urethra. That's what keeps it actually from falling out. Your bladder feels this balloon and occasionally will try to just squeeze it out. Men will experience that as sudden discomfort, either in your lower belly in the middle or at the tip of the penis. It will subside with time, but if you're getting lots of bladder spasms, you've been prescribed a medication called oxybutynin or ditropan to take as needed, which will decrease the frequency and severity of those bladder spasms. If you're not having bladder spasms, you don't have to take that medication. What about blood in the urine? It is very normal and expected to have blood-tinged urine on and off. When does that level of blood in the urine concerning? Well, if there's too much blood, and of course it's a spectrum and it's a judgment call, but what we recommend is look at the tubing that's draining the urine, not the urine that's made its way into the bag. If you imagine that you had a magazine or a newspaper behind that tubing, could you still read the letters through the tubing? If the urine is so blood-tinged or so full of blood that you couldn't read newsprint through the tubing, that's probably something you ought to give us a call about. It's also a situation where you should increase your water intake. Start drinking a cup of water every hour and see if you can dilute the blood and get that urine to lighten up. Bruising around your incisions can sometimes be quite significant. It might not even be present in the first few days, and it might show up a few days later. Significant black and blue of the abdomen, penis, and scrotum is normal. If this is associated with lightheadedness, dizziness, please call us because that level of bleeding might be severe. Let's talk for a minute about bathing and showering. About 48 hours after your operation, it's safe to shower. You can let the soapy water run over those incisions without any danger to them. We recommend not submerging in a bath or swimming pool for at least 2 weeks after your surgery. Walking is extremely important. It improves virtually every aspect of your recovery. It makes your intestines wake up and function quicker. It decreases the chance of blood clots forming in the legs, which can be dangerous. It enhances your recovery in virtually every possible way. We recommend you walk at least 6 times a day. If you're even more ambitious, walk at least every hour while you're awake during the day. Start with short walks, close to a chair or a couch, and then extend your walks little by little. Chewing gum is a good idea. Why do we recommend chewing gum? Chewing gum starts your mouth salivating, and it actually tricks your intestines into thinking that you're eating. They respond by contracting, and it can hasten the process or speed up the process of your intestines waking up again after surgery. This is not mandatory, but it can help. Another important thing for you to do is to focus on taking deep breaths. The hospital may have provided you a plastic device called an incentive spirometer, which has a tube that you put your mouth on and suck in air forcefully so that you fill up your lungs to their full capacity. Even without that device, when you're sitting around, try to remember to take full, deep breaths, even if it hurts a little bit in your incisions at the end, to try to expand your lungs. This is very important because it can prevent things like pneumonia from developing after any surgical operation. One thing to keep in mind is that having a fever on the first night, the day of surgery leading into the next day, so the first night of surgery, is extremely common. Fever on the first night is so common that we typically don't get concerned. It's something that you should essentially expect may happen. Let's talk about toileting issues. We recommend that you take a stool softener, something like Colace, because we don't want you to strain if you can possibly avoid straining to have bowel movements. If you do have a bowel movement, it may be inevitable that you have to strain at least a little bit, and it's quite common to see a little bit of blood in the urine or even around the catheter after a bowel movement. That's not something you ought to worry about. What are warning signs that should lead you to pick up the phone and give us a call? Well, I'll go back to the fever issue again. If you have high fever, shaking chills, generally there's no exact cutoff, but fever over 101 we'd want to hear about. So high fevers or signs of redness or drainage from your incisions is another reason to give us a call. We want to make sure that you don't have a wound infection. They happen rarely, but can be treated by antibiotics if they occur. There's two very important events that if those seem to be possibly occurring, you want to pick up the phone. One is a heart attack. So chest pain, radiating or traveling to your arm or to your jaw, could be a sign of a heart attack, especially if you have underlying heart issues. We would definitely want to know about that. The second thing is a blood clot traveling from the legs to the arteries or veins in your lungs. That's called a pulmonary embolism. That's a serious condition that can lead to shortness of breath and chest pain, especially when you take a deep breath. Sometimes if there's still a blood clot in your legs, that could cause swelling on one leg but not the other, or pain in your calf. Certainly give us a call if any of those things are occurring. Significant blood in the urine, again, we talked about. Low levels of blood are perfectly normal, can even start and stop again and then restart. But again, if the urine is Merlot wine colored or very deep red where you can't even see through the tubing, or if clots are blocking the catheter completely, you ought to give us a call. Speaking of catheter clogging, again, if for any reason the catheter seems to be not draining in through the tubing and filling the bag, and you're feeling increasing discomfort in your lower abdomen as if your bladder is filling, please give us a call so we can help you. If your intestines seem to have fallen asleep and are not waking up, you're mostly burping and very nauseous or even vomiting significantly, and you just can't hold anything down, we need to know about that. And in some cases, this requires you coming back to the hospital for us to take care of you till your intestines wake up again. I hope this video has given you a sense of all the issues you're likely to be thinking about after your robotic prostatectomy. Please understand that someone is available 24/7 to answer your questions if you're just not sure if something's going on that is expected or unexpected after your operation. Call the main number of the hospital and tell them about the issue that you're facing and ask to speak to the urologist on call. Thank you very much for trusting us with your robotic prostatectomy. And we hope this video has helped you understand what's in store.